All right, do we switch over to me? Hello, everybody, and welcome to the 3D Dentist Studio, where we are coming to you live with my new voice. Now, in all seriousness, here's the deal. Sleep apnea is probably one of the best things you can implement in your practice because it unlocks an untapped potential within your practice, but it's also one of the most difficult things to implement because it is so unlike anything else we do in dentistry. And as trainers of sleep apnea, we've seen it all. We see lots of people who come back from our classes and they go gung ho and they do very well. We see a lot of people who are happy and they get to that 2-3 device a month and they know how to answer the questions. But we also see quite a few, frankly speaking, who struggle to get it off the ground. And this Q&A session is really designed around two types of people. Number one is if you're struggling to get off the ground, we want to kind of talk you through that. And if you're also in a situation where, hey, I'm doing 2, 3, 4, 5 devices a month, I'd like to really step it up a lot. We want you to ask questions and I want to answer those things as well. As always, we're joined by our great friend, Erin Elliott. Erin, how are you doing today?
I'm great.
Wow, it's
I'm
so
obviously
light
in a little.
outside.
I know.
It's so light
Yeah.
outside there.
Well,
And of course, I'm
in the
joined by
winter.
Meredith as well.
Yes. Hi,
Hi.
Meredith.
So, all right, let's. Erin is joining us from not Boise, Idaho, but Coeur
Up in the
d'Alene
tip
area,
and
Post Falls, Idaho,
yep.
which
Yeah.
is in the top left side of Idaho. But I think that joke's old now. I think after
I
5
know.
years,
Everyone's heard it. Yeah, very north, almost Canada.
yeah, almost Canada, almost Washington
Not a
State.
suburb,
Yeah.
but 8 hours north of Boise, not a suburb of Boise. But I was kind of the one that got a bee in my bonnet about this because, you know, when we teach, it's like I want to get the message out there that dentists should be doing this. We can be doing this, and there's so many patients that need our help. So it's like I just want to hand over everything possible to fast forward the mistakes that I made, the stumbles that I had, and then I just kind of like hang my head when I hear that people aren't really doing it. So, even though everyone usually is really excited, I think there's times we lose momentum. So I put up a poll, POLL, in our forum because we do have ongoing help after the course, and just wanted to ask what some of the roadblocks were. And in using T-Bone style, I would love to break down some of those barriers. And of course, I'll let you guys leave with what was taught. And there was one option on there that I was surprised didn't get one vote. And that was the patient being not open to it. And, when I first started 12 years ago, that was some of what I got was the patients had never heard of a dentist doing this. They don't have a sleep problem. And there's still a lot of people in denial, but I don't think it's as from left field anymore. So I was kind of surprised that wasn't an issue. And so you guys kind of share with us some of the top after T-Bone finishes a bite of the soup.
Yeah, right? I was like,
How
at
do you know
least
I'm on
move
the-
your
How do
microphone.
you know I'm on? You can't see me.
I
We can hear that slurp.
Well, listen, I know this is a little off target here, but I don't like cold food
We can heat it back
or
up.
lukewarm food. And I don't do microwave.
You don't even know that it's been microwaved.
Well, what I'm saying is I don't do microwave.
Right.
But anyway, all right, let's start.
Okay.
Meredith, what's the most common question that we got on our little poll?
So
here?
on the Where's Your Roadblock poll, we have figuring out of pocket with medical insurance as the number one reason people are not doing as much sleep as they'd like.
All right, so before I turn it over to Erin to answer this, here's a point I would like to make, okay? And honestly, when we started doing sleep in our practice, I made medical insurance a crutch. And we were very fortunate. We work in an area in North Carolina where we have good coverage for medical insurance. And then I'm also very fortunate that I am in network with medical insurance as well. But what I will say is you can do 2, 3, 4, 5 devices per month without ever dealing with medical insurance by just not bringing it up. Or when patients mention it, say, unfortunately, your deductible's high, and you're going to have to meet your deductible at some point in time, so you might as well deal with it. That's not necessarily the question. The question was how to determine the
Yes.
out-of-network, the
Out-of-pocket.
benefits. So, Erin, why don't you but that was my point in this, is that we want to answer the question,
Right.
but I also want people to not make insurance the thing.
Yeah, and also I know we say it over and over again, but we know plenty of people who are doing this without taking insurance at all.
Yeah, absolutely. So we'll turn it over to you for a
Yeah,
little
and
bit,
every
Erin.
state, okay, every state really is different. And every state kind of has its main payer as far as Blue Cross Blue Shield is usually in every state. And the allowables are all over the map. So, what I mean by allowable is that for that code, it's a medical code for an oral appliance for obstructive sleep apnea. Each insurance has what they'll pay capped out, and they usually cover 80% of that. And then the patient has to come up with the other 20% after deductible. And so it's very simple to find what deductible is, but it's not so easy to determine what the allowable is. But as you get going, you'll keep track of that and be able to estimate a little bit better. But that sounds overwhelming, right? And I think I focus on medical insurance too, because that's what really helped sleep take off in my practice. However, I didn't start out that way. I started out with a cash fee. You can bill your medical yourself. You can figure it out. But I didn't really do that many, but it's possible. And what I think is interesting is the two mindsets. One, that as the dentist, we do kind of focus on insurance, but we also are selling more the appliance versus what the patient will benefit from the appliance. For example, when we for some reason can sell a $5,000 Invisalign or a liner case, and the patient doesn't, they understand that it costs that much, and they don't look at the aligners and say, those cost $5,000. No, they know that that's going to get them to a straight smile. But when we offer an oral appliance for, let's say, $2,500 cash fee, all of a sudden, the patient looks at it and says, that costs $2,500. Well, no, the program costs that much. So I think we focus so much on that. And I know, T-Bone, you probably have some good tips on how to overcome that. But even if you always talk about like getting back from a course and having patients that you start out on, patients that are patient, understanding, know that you're learning your way, and just saying, you know what, work with us here. This is our first time billing medical. You know, getting that understanding from patients just to get started. I think that's the biggest thing, is just get started. And then pretty soon it becomes routine. Like, remember when a class 1 amalgam was the scariest thing we ever had to do when we started in dental school. So we just have to get started.
Yes, what I would add to this is I love your example about orthodontics, because in a way, one of the best things that happened for us was that orthodontics on dental insurance stopped paying typically for adults. So when our adults patient came in, we could always use the excuse or the fact that dental insurance typically doesn't pay for it, and patients were like, okay, because we had confidence in saying that. And I think one of the challenges is that on sleep apnea devices is that we're so built into the mindset of medical insurance that it holds us back and makes it a little bit harder for us. And so I think always, and I think we'll answer this question a little bit later as well, I think we have to immediately present affordability as the option after we go through medical insurance. So let me kind of give you guys a little bit of a script on this. I'm going to use Michelle, who's sitting here ignoring me right now. as my patient.
You got called into
Yeah.
this.
Michelle, I'm glad that you're interested. I'm glad that you're interested in getting this sleep apnea taken care of. From other patients we've worked on, we know it's going to dramatically change your life, and it's something that you want to do because you're tired of other people telling you that you snore, and we want to get this taken care of for you. We've gone through and looked through your medical insurance, and unfortunately, while they do have coverage for the device, you haven't met your deductible for the year. So that would leave you having to pay about $2,400 for the device. The great news is that we do have affordable monthly payments that can drop this anywhere from $100 to $200 per month, so that you can go ahead and get this medical condition taken care of, so it doesn't continue to affect your life. And I think that's the key component there is we lead with medical insurance, and then as soon as it doesn't pay or it doesn't make it easy for the patient to say yes, we don't have a solution for them. And that's the key. You've got to have the alternative solution in terms of how to make it affordable. And that was important. We have an important question for you, Erin. It's a type in from a audience member. It says, please ask Dr. Elliott why her husband wanted to punch her in the face 2 nights ago.
Oh, did he say that? Or was it him? Because anyways, I was snoring. I was snoring.
Did that make sense? Do you think, Meredith, we answered
Guilty.
that question pretty well on the medical insurance side of things?
Yeah, I was actually going to bring that up because 2 of the top 4 of the poll were financial. One was financial presentation, and one was getting patients to say yes to the appliance / seeing the value. And so I think the making it affordable wraps both of those into one once you move past what the patient's out of pocket
Yeah.
it's
I
going to
mean,
be.
look, we have to
Oh,
utilize medical insurance. Go ahead, Erin.
I do think there is a separate component to creating the value in it, because a lot of times, and we can move on to that next if you
Yeah,
want.
go
If you
ahead.
want to finish up medical, well, I'll just finish up with medical billing and estimating out of pocket. Like, since each allowable is so different in each state, there are some states that it doesn't make sense to be in network or to bill medical when they'll only cover up to $900.
Right.
Um, and so, but you don't know some of these things, and you're not confident in presenting. Like, well, it could be 200 out of pocket, or it could be 2,500. Like, which patient? How is the patient sign up for that? Um, but also, I think, like when I got my knee surgery, and I asked them how much it was going to cost me, they like laughed at me. And I don't know many other medical offices where they tell you what you have to pay out of pocket for a procedure. So I think we put some of the pressure on ourselves, because in dentistry, we're able to do that a little bit more down to the dollar. So, like T-Bone said, it's just we're focusing on it, and then we're not confident in presenting it.
Yeah.
And so patients are kind of wishy-washy as well. So, I think getting started on patients that understand that you're getting started, and it won't cost you more than this, but we will try to get them to kick in benefits, might be a way to just overcome that barrier.
Absolutely. So, Meredith, what's our next question?
Our next thing would be making it a priority / time.
Yeah, you know my answer. Oh, by the way, Sarah Swift said, she said, I hope she punches him.
I also
Me-
have
me-
something to add for that.
Meaning Erin punches Tom. So, Tom, I think you're in trouble.
Yeah.
T-Bone and Sully shared bunk beds this past weekend, and Sully said, "Put your sleep appliance in," and he said, "It is."
No, I said, "Ugh, on."
And he said, "Then change your bands."
No, he said, change your position. Like, as in, get off my back and get to the side or something.
No, the first day he said he told you to change the bands as it wasn't working.
It was working just fine, okay? I slept
We'll have to
great.
talk about that.
All right, so
Time.
time. Yes, thank you.
Yes,
Focus.
time and priority.
Thank you, Squirrel.
I mean, it was on topic. Okay.
Well, many of you know. Look, I think sleep is one of those things that is. there is a level of difficulty to implement this in your practice, especially if you're trying to go beyond 2-3 devices per month. Okay, and I think, quite frankly, there is, in my opinion, and I know there are other ways of doing this, but in my opinion, there's one nearly foolproof way to do this, and that's to treat sleep as a startup storefront in your practice. So just like when you started your practice, you took a risk, you had capital, and you just got started. And in the beginning, you were losing money, or you had more team members than you needed, and you have to treat sleep that way. I am absolutely 100% certain that our success in sleep has everything to do with having a dedicated person to sleep, somebody that takes ownership. We call them champions in our language. Somebody that takes ownership of referrals from the team members, referrals from the outside, making sure that our third-party biller does their component. Our champion does their own benefit checks because we want answers quicker than typically third parties can provide it. And they make sure the laboratory and all the clinical components are handled. So I think that that's the important part. I think that's not having that, that is really what holds people back. And that doesn't always have to be, and Erin reminds me of this all the time, and as does Liz, is it doesn't have to be somebody 100% dedicated to sleep only, but there has to be somebody that owns sleep. And as the dentist, you do have to block out some time, whether that's 4 hours a week or 8 hours a week or 16 hours a week, to allow this person the runway to get this off the ground. And they also have to
And they may
understand,
not be doing anything. Oh yeah, sorry.
and you have to
They may
understand
not be
also,
doing anything during those times.
right, exactly. And you also have to understand that this doesn't happen in a few weeks. And in fact, the quickest any device can be delivered from the day your patient says yes is typically 3-4 weeks between getting the data, doing the medical insurance, doing the pre-authorization, sending it to the lab, waiting for them to send it back, doing the delivery. All of that stuff is no different than when you send crowns or something to the lab. There is a turnaround time. So it is a 3 to 4 week lead time to get your first device off the ground.
At the very fastest.
And
I think too that we make the mistake that it's always the lead assistant that you put in charge of it, because they're usually willing to step up, and sometimes there's a diamond in the rough, and they're not usually given enough time. It's like, oh well, Sam's not doing anything, let's call her chairside, we have an emergency.
Right.
Or Sam's not helping in sterilization, that jerk. So you have to make it an understanding amongst the team that there is some admin time, there's some development time. Even keeping top of mind, looking at the schedule the next day to ask the hygienist to find their patient of the day. And when it says no time priority, the hygienists are sitting there, well, I don't have time to talk about sleep when I have to scrape, calculus and make their next appointment and talk to them about treatment. So
that's our next subject.
You talk about, okay.
We'll get there.
So making it a priority, keeping it top of mind with the team, finding that champion that's not always the lead assistant, and then being strict about allowing them the time to develop the program.
Yeah, I think the time, this is a different type of time, but I think people give up before, we always say it takes like 6 months or so before you really get your systems in place and you see it take off, and people give it 3 to 4 weeks, 6 weeks, and they've done one appliance and they're like, well, this isn't worth it. And they give up. So I think giving it that type of time for that length of time.
It's a slow brew.
It is. And if guys don't mind, I'd like to take a moment, and we can leave this all up here. I'd like to take a moment to make a quick commercial for our sponsor tonight for 3D Dentists, which is me. No, I'm just kidding. It's much more than me. It's Erin, Sully, it's JP, it's the whole crew. Listen, I know there's lots of choices for sleep apnea education out there. And what I would like to say about what we do is we teach a practical workflow. We provide good science behind it. But I think what really makes us stand out is the fact that we focus on the business side of things and the strategies of each team member And I think the other part that's very critical to understand is we're all general dentists. We're not sleep specialists or sleep dentist specialists. We are general dentists who have made sleep a part of what we do, and we're trying to implement that for you as well. So it's a different world when you're learning from somebody who all they do is sleep, and there's a lot to learn from people like that. I'm not saying that, but I think when you're getting started, in my opinion, it's not the best place to get started. And just because you've taken a class once doesn't mean that you shouldn't take it again or you shouldn't send team members to it. It's no different than watching a movie. When you watch a movie the second time, you pick up things, you learn things, you come back with different questions that you can answer. So for those that have attended our classes in the past, we do have an audit rate to come to the class. You just contact Meredith. That's
You
her
can't
over
see
there.
that here. You can't see.
And obviously for your team members as well. So we want to make sure that you're aware of that
Or the
as well.
online is a really good
Yeah,
refresher.
and then the online program where we have it available online, where you as a whole team can take up to 6 months to watch it all, which is a phenomenal option as well.
Yeah.
So,
Well, I was going to bring it up a little bit more subtly.
okay, no, I like that. Boom,
Commercial.
right out there.
Because that takes us into our next roadblock. Our next roadblock is getting the hygienist to bring it up. And if you've talked to me on the phone and you call and you say, I want to do sleep, I typically say the one thing that people who are successful do versus people that aren't is bring their hygienist, because that's where that's who most people leave out because they want to leave them at the office working, right? But that's where most of your referrals come from, because they know your patients. They spend the most time with your patients while you're getting patients from your office.
Yeah, the only thing I'll say about the hygienist is I'm going to put a lot of blame on the dentist on this. And that's because we set unrealistic expectations and we set up our hygienists to fail. I believe in a concept of boiling them slowly. And when you go back to your hygienist and have this new shiny toy, sleep apnea in this case, and you want them to bring it up to everybody, they have literally minimal education on it. They have a minimal comfort level. They don't even understand what it is, why it's important, any of these things. So I always say, obviously the education's important. Selfishly, that's what we do. But I think the other component of that is you got to just ask them to talk to one person per day. That's it. That's enough. If you can do one person per day, that's a great start, and they will naturally become more comfortable.
Not overwhelmed.
And we're just talking about just talking to them about it, not even like saying they have to get an appliance. It's just bringing it up to the patient.
Yeah, absolutely. It's just a matter of just bringing it up, and so Erin, if you don't mind, can I'll lead you with this. I'll lead into it for you. When we talk about hygienists, hygienists fit in. We have a 4-step workflow that we teach. We teach awareness, assisting with diagnosing, financial, how to make it affordable for the patients, and the clinical components of it. And your hygienist really fits into the awareness component of it. And when we talk about awareness, I refer to dental physical conditions and then medical non-physical conditions. And Erin, can you go through, I'll go through some of the non-physical conditions, the medical conditions. And if you don't mind, give us 3 or 4 dental conditions that hygienists, the top 3 or 4 that the hygienist should be aware
So
of.
the top 4 answers are on the board. I would start with bruxing and clenching. I'll just put those together so I get other options. But we are connecting, or not we, but researchers are connecting bruxing and clenching with, propping open the airway. So if we see tooth wear or abfractions, or patients complain of it, then I automatically ask if anyone has ever told them they snore. The second thing that is it's indicative of 70% of that population has an HI over 5, which is considered sleep apnea or mild sleep apnea, is a scalloped tongue. And that's not a decorative term, but it's when the patient first opens, you can see ridges or indentations along the side of the tongue. And that's an indication that there's just not enough room, so it has nowhere to go but back. And then we have acid erosion, And 66% of acid reflux sufferers actually have sleep apnea, and a lot of acid reflux sufferers show erosion in the teeth but don't have the typical heartburn symptoms. So we talk about atypical symptoms in the course. And then lastly, it's just their airway in general. Like, what is it, red and beat up? Is it swollen, narrow, battered uvula, that kind of thing? So those are the top 4 dental signs and symptoms.
So, and just do you mind wrapping that up again? Go through the top 4 again without all the explanation behind it. 1, 2, 3,
Yes.
4.
So, bruxing.
Okay, number 1 is
Then
bruxing.
scallop tongue,
Number 2 is scallop tongue.
acid erosion.
Number 3 is acid erosion. Just in case they didn't hear you, I'll just repeat it.
Yep. 4 is airway
Number 4 is the general look of the airway.
or throat.
And so in the throat, basically. So those are 4 physical conditions, as I term physical conditions, that your hygienist should be looking at almost every single day on almost all their patients anyway. And if they notice some of these things, at that point, what I want them to do is start looking at their medical history. And I'll walk through the top 4 conditions that we're looking at on our medical history. Number 1 would be cardiac conditions. In this, I would look at stroke, heart attack, high blood pressure, and the medications associated with that. And you know that's a very high percentage of patients that have sleep apnea that have these cardiac conditions. Number 2 that I would look at is diabetes. And there's what was so funny there?
The way you said diabetes.
It was diabetes. Isn't that the southern way of saying
No, it's
it?
that one guy from the commercial. All right, sorry, keep going. I won't laugh at
Number
you
2 is
anymore.
diabetes. Diabetes, okay, type 2 diabetes. And if I remember correctly, I think it's 72% chance of your patients that have type 2 diabetes have obstructive sleep apnea. Number 3 would be psychiatric medications. Patients with insomnia, major depressive disorder, depression, anxiety. There's a high percentage of those patients that also have sleep apnea. And number 4 is one that Erin kind of mentioned, and that's acid reflux. Those patients with acid reflux also have a high percentage chance. And the truth is if you really listen to what we just said, and let me repeat those again. 1 is cardiac conditions, 2 is diabetes, 3 is psychiatric conditions, and then number 4 is acid reflux. That probably constitutes 60, 70, 80% of your patients. And
I think you got all 4, T-Bone.
I do. Yeah. Yeah. I have all of it. I was thinking that maybe I didn't have the psychiatric conditions, but then I said that was first on the list. And so I'm not saying that those patients have sleep apnea. What I'm saying is there's a likely chance that they have sleep apnea. And our job as healthcare professionals is to inform our patients. And that's how you move into the next step. And that's where you give them the opportunity or encourage them to take a sleep test to rule out whether or not they have obstructive sleep apnea. So that's kind of, to me, not in a nutshell, but a long way around it to answer. What was the question again, Mary?
What are the signs and symptoms of
Getting your hygienist
Getting your
hygienist to bring it
She
up.
even forgot the question at this point in time.
Yeah, but I understand, like, not anybody and everybody has sleep apnea, and the hygienists do have a lot to do. However, it doesn't seem so formidable if you just ask them to bring it up to one patient. And, the dentist doesn't have time. And oftentimes I hear like, well, I don't know why patients don't move forward, because I educate them. And as soon as I hear that, what I hear is they do all the talking and the patient doesn't do enough. And really, you need to find what the pain point is for that patient. So we do talk a lot about these kind of subtle things in the course that we have at 3D Dentists, which we will be doing a course next week at the new retreat center.
Yes, and then we have another one, I believe, April, correct?
Yeah.
And we have another one in Phoenix.
We're just back to back to back. We're just
Erin's ready to get the hell out of Idaho because she's afraid her husband's going to punch her in the face.
No, it was the opposite. She was gonna punch him.
Yeah.
actually.
No. I think, were you going to
Um,
punch him or is he going to punch you?
he was gonna punch me because I was
No,
snoring.
I want to be
Oh,
clear.
okay.
Sarah made
To
sure
people
that
that
I
don't know,
punched him.
Tom was not going to punch Erin.
She was gonna punch him. It's fine.
No, it's all good. I'm all good. We have a very fun relationship. It's all good.
What's next, Meredith?
So, skipping down a little bit, we have getting the whole team on board, which kind
Yeah.
of goes with that as well.
Yeah.
And I think one of the things with Erin's course, I try to explain to people that if they're not comfortable treating a medical condition or they haven't been trained properly, they're probably not going to bring it up to
Yeah.
patients because they don't feel confident, where they think it's okay for the doctor to. But for team members who have taken the course, whether it's online, in person, they feel much more confident bringing it up.
Yeah. And, one thing I would like to say, and I'm going to unsell a little bit here, is look, you don't have to bring all your team members. That's an excuse. I think you can get core people to go back and
Right.
teach the message. But on this question, I want you to repeat the question again, if you don't mind, Meredith.
Getting the whole team on board.
Getting the whole team aboard. I think there's a simple key way to do this. And that is when you get back to the office, you don't treat patients, you treat every team member and every team member's bed partner. And the reason for that is several things. One, you get used to the equipment and all the processes that involved. Number two, your team members understand what you're asking the patients to do. And number three, you start understanding a why and you start making a connection between the sleep test results, the home sleep study results, and your own life. And especially if you got to the point where your team member needs a device and you're kind enough to make them a device, it changes it. When I was in dentistry in the early 2000s and I wanted to do more porcelain cases, I was always told, then treat one of your team members and let them be your shining example. When I want to start doing more aligner therapy, get some retainers for all your team members and make them wear retainers, whether they have, whether they need ortho or not, so that patients will start asking about it. Or you can make a comment, hey, by the way, did you know that I had Invisalign or Sure Smile or XYZ on? And so the same thing. If you really want your team to be successful, treat them. And that to me is the main key to getting your team on board. And or the next part of that would be, if you have the wrong people, stop being afraid. Just move forward. Shit or get off the pot, if I'm allowed to say that.
You can. It's your show. I think too that's a great. It helps you get comfortable with scanning and taking the bite and establishes a relationship with whatever lab you use. It really helps break down those barriers so you're not as anxious about bringing it up. And here's the other thing is what if I don't know the answer? And it's like, well, that's great. When a patient asks a question you don't know the answer to, that's a great question. I am going to go find out the answer for you.
Yeah, it's a great opportunity
The
to get in touch with the
worst you'll
physicians.
say is, I don't know.
Yeah.
Yeah.
I mean,
So
here's the question I have
sorry.
for dentists. Do they have every answer for their patients?
I think we're expected to, or we put the pressure on
I
us
think we
to.
put up pressure
I
on
don't know.
ourselves. I mean,
Yeah.
I don't think our patients know that we know. And
And Meredith, just to go back to the value thing, I think that oftentimes patients think, well, this is how I've always lived. Like this isn't gonna change me. I get that comment all the time at delivery. Well, I hope this works. I'm like, well, if I had $1 for every time I heard that, I'm like, wait, I do at least get $1 when people say that. But the more people you treat, the more they tell others. I would say 40% of our patients referrals come from other people we've treated. So getting that value across, I think you really need to get down into the patient's story and how it's affecting them. Whether it be snoring that their wife complains all the time, waking up 4 or 5 times a night, that's not normal, and many patients think it is. Using the restroom several times a night, is it, they're exhausted and
does it count
they
if you use the
can't seem
restroom
to
in the
get through
bed?
their day.
That's probably worse.
You want to depend, or how about all the
You want
money they're
Depends.
spending on energy drinks that we could save you? I just think that we can't treat the numbers in the textbook. There's a human being, and that's one thing that we forget to connect. So when we're talking about value, we're not learning to communicate with patients. We're not learning how to take all this data we get from a sleep study and showing them that, yeah, you got a phone call from the sleep lab that says, you have it, but it's mild. Are they going to go spend all, $2,500? But when you show them that mild case is actually you closing your airway closing down 80 times, that really changes. Like, it's my favorite thing is to see that change, that shift in their face when their eyes open wide, like, holy cow, this really is affecting me more than I thought. And I know there's some nuances and a little bit of an art to it, but I think that's where a lot of dentists miss patients that they could help or creating the value in.
Yeah, I think it boils down to dentists get scared. We're taught that we can only treat certain types of patients and certain levels of patients, and that we can't do anything without asking the government or the physicians or the lawyers. It's like we're not allowed to do anything. We can't think for ourselves. And the truth is, we just got to get started. We're going to make mistakes, okay? And it's a removable device. I mean, you can just take it out of the patient's mouth. You can give them the money back, if that's what
Yeah,
it takes.
it's scarier cutting a veneer case, honestly.
All right, so we have one question here. I do want to answer this. I can't. All I see is Facebook users, so I don't know who wrote it.
If it's coming from a group,
Okay.
that's why.
So it says, from a production standpoint, this is a ton of effort on the dentist's end to sell a $600 sleep appliance. So I want to talk about that. Number one, it's not $600. Maybe your lab bill is $600. That's pretty close to being true. But the average device in our practice over the years, north of $2,000. And you're right, it is a lot of effort on the dentist's end, and that's why we focus on making it a team-driven procedure.
Yeah, very much so.
Yeah, so yes, you're right. If it was honestly a work that I was doing all the time, then quite frankly, I probably wouldn't be as successful doing it.
I was just gonna ask you, when's the last time you've done a sleep appliance?
Well, listen, I see all the patients,
Right.
in
Yeah.
terms
You
of
check
meeting
in on them,
But
but
I,
no different than a hygiene.
But you know what's amazing? When I go in and say, "Hey, I'm always here for you. If you ever have any questions or we run into trouble, I'll be here. But Liz is going to take great care of you." Not one of the patients said, "Oh, you mean you're not going to be taking care of this
Yeah.
from beginning?" Not one.
I
Not
think,
one.
you know why? You know why that is, T-Bone?
Even the wife of the physicians who come to see us, or the
Yeah.
physicians, they don't say, "What do you mean?" Like, they're the ones for sure. They're even shocked to see me, to be quite honest with you.
I think that's what it is in the medical world. You deal with the mid-level providers or the nurse. Like, you rarely get the actual doctor time. So I think that there is a little bit of a mental shift that they don't expect to see me all the time. So yeah,
And frankly,
chairside
they don't
time
need
is
to see you all
valuable
the
for
time.
dentists.
They don't need. This is not one of those procedures where they need to see you all the time.
I'm doing dentistry most of the time. Can I ask what time it is?
8:50.
8:50 our time. I don't know what it is over
Okay,
there.
great.
I don't know what it is on the moon where you're at. So Sean asked a question. Do we have any other pressing questions from there? Because there's someone here I would like to ask.
No, go ahead.
No, I
Okay.
think
Yeah.
that was kind of it. Yeah.
Okay, so number one, I always like to shout her out because she always shows up, and that's Dana Irby Horton. She is always there. If we could all have team members like Dana, we'd be dentistry would be so much better. So, and Dana mentioned this. She said, "My patients say I'm here to see Dana, not Dr. Bear,"
That's true.
which
Liz
is
too.
probably a
Sam
good thing.
too. Yeah.
Same thing with Liz.
Well, you know what? I think Dana could probably say this, that Dr. Bear had to get out of the way
Yeah,
Yeah.
absolutely.
a little bit.
All
So,
the I had to get out of the way. I used to take all the bites and everything, and one day, like, I was busy doing something, and I walked in, and Liz goes, "All right, I'll get this out." She was already taking the bite. We're good. I said, well, let me at least check it. And I checked it. I'm like, okay, I guess you know
And
what
then
you're
you
doing.
never did that
But
again.
it was no different than when I was working with Liz on CEREC, when I was working with Liz on implants, all that stuff. All right, so another question. The same Facebook user said $2,000, a little different story. And even then, even if it's $2,000, $1,500, the numbers are somewhat irrelevant to me. I do want to mention this. Number one, charge what you're worth. You're providing a medical service. Charge what you're worth. Okay. It's important for us to charge what we're worth. I don't want to get into too much there. And then Sean Thompson asks, how do you attract patients outside your practice that want apnea treatment? So I'm going to defer to Erin after I make one statement. And the first statement is, I don't believe that as dentists, we should be going out and asking for referrals until we actually know what the hell we're doing. And by that, I mean, we should be doing 2, 3, 4, 5 appliances consistently from within our practice before we go out and ask physicians to refer to us, because nothing will break a relationship with a physician and nothing will ruin it for dentistry in general than their patients coming to you and having an experience that isn't fantastic. And when you go to physicians and ask for referrals, they are 1,000% dictated and crutched on medical insurance. So if you're going to go outside, and ask for physicians referrals, you better have your medical insurance game on point. I'll turn it
Yes,
over
and
to you.
they don't care about credentials or your training or anything. It's insane to me. It's all about medical insurance with physicians. I would say that that does come not necessarily slowly, but you have a good experience with your patient. I will even tell the patient, hey, could you tell so and so, your physician, what a great experience it was here and how well you're doing with this. I think the biggest thing is sending letters. That is the easiest, cheapest, best way to get into a physician's office, because, and especially now with COVID, it's much more difficult. I play soccer with physicians or their nurses, any sort. I'm in a smaller town, and I wasn't afraid to market. It's not a 4-letter word in my book. Most of my marketing is towards sleep versus dentistry, because that does make us, what we provide is special. And it attracts patients because they didn't even know it was an option. So I'm just trying to get the word out there that oral appliances are an option, and that sleep apnea is much more, it's not an old fat man's disease.
Absolutely. So Sean made a clarification. I'm giving Sean Thompson a lot of time here, a lot of effort. I like this. Okay. I'm just somewhat being joking here, but he says I'm speaking about marketing, so I'm assuming he's referring to external marketing. So let me talk a little bit about internal marketing, and then I'll let Erin talk about external marketing, because I believe, Erin, you've actually done some external marketing for sleep. So on the internal side, before you go outside, look, I'm always a big believer, before you go outside, you go inside. Before you go outside to physicians, you go inside to your patient base. Before you go outside to external marketing, you go inside to your internal marketing. Internal marketing for me would be, are you using your patient communication software, things like RevenueWell, Modento, Lighthouse, whatever different products there are out there? Are you sending out blasts? Number 2, are you doing a blog on your website where your patients can read it? And that also goes into external marketing as well. Number 3, are you doing subliminal marketing? I can't tell you how many patients bring up sleep apnea or snoring because we have digital signs in our office that talk about that, and same with Invisalign, all the different things there. So internally, and then internally is also your patients. Your team members. So those are some of the internal areas, and having signs out that you can do. So Erin, do you mind talking about your external
And none of those
efforts?
things cost what?
Oh,
All
the
of those
sign costs
internal
35.
marketing things you
The
talked
sign
about.
costs $35 to
Yeah.
get printed at the
Yeah.
Kinko's.
And if you're a
Hope you get to
non-poster
go to
kind of
Kinko's anymore.
office, then I think you still need to have some sort of sleep literature up where patients do bring it up. Um, Oh, external marketing. We do the little health fairs and expos. I do newspaper still works around here. We do video testimonials and social media. Uh, Really, I do some lunch and learns. We've hosted dinners before. The local CPAP rep and I did a dinner. So there's a lot of opportunities to get out to the public as well as to physicians. You do have to beat the pavement or give time to your sleep champion to do so. Really, if you have any sort of personal connection or patient that works at a medical office, I think that is always beneficial, because as soon as they meet you face to face, then they're like, oh, okay. And I get 2 minutes of their time to explain that sleep apnea is not an old fat man's disease. We start seeing more referral. And here's the other thing: we'll bill medical, we'll keep you informed. If you refer off, we will take care of the patient from beginning to end. You don't have to worry about it.
Yeah, absolutely. Matt Standridge said, "Can't I just pay $100K for exclusive rights to my zip code?" Number one,
His zip code's probably not that big.
where Matt lives, I hope he wouldn't pay $100,000 for the
No,
rights to his zip code of 800 people.
There's a little bit of
There's tongue in cheek there.
reference to
Yeah, we're not
a
going to
little
talk about
reference
that.
to a fight I got into.
That and there are people out there that will sell you magic bullets. And as an educator who makes money selling classes, I will tell you our class is not a magic bullet, and there is no magic bullet to anything. Okay. Is there anything else, Meredith?
No, I think that's it.
I gotta go
Erin,
get stretched.
You got dark
I
there
really
all of a
didn't know
sudden.
exactly what you said there. So
That sounded very southern. You've been hanging out here too much.
Stretched. I gotta go get stretched at Stretch Lab.
if you are interested in adding sleep apnea to your practice, if you have taken other sleep classes and have struggled to get it going in your own office, please do consider 3D dentists. With Erin, we provide phenomenal sleep apnea training. We have our new 3D retreat, our 10-acre campus, our retreat center, which has the lodge to stay in, the training center, and the loft for team escapes. It's quite frankly phenomenal. I'm so excited for you to see it, Erin, when you get here next week. And it really, I think, was going to enhance our education, because for those who choose the VIP add-on experience, they will get time to spend. We will spend time with them, and they'll get to pick our brains until we're gonna have to set a time limit to this. Okay, I think
Until bedtime.
I think this
I
2
do have a
a.m. business
bedtime.
wasn't so great for me, but it was so much fun. And here's what I'll tell you: if you're serious, and if you're a winner, don't come without your team members.
If you're a winner, here it is again.
Well, no, because I say that
It's true.
If you
It's
want
true.
if you want to win, bring one or two bring key team members. Not all of them. Look, I like to take your money and take all of them, but that's
It's not always practical.
well. It
We get
also
that.
takes up a lot
Yeah.
of space. I will tell you that you need to bring a couple of team members.
Yeah.
One, they'll get great education. Number two, will motivate them, and they'll also get to meet my sleep champion. They'll get to meet some team members. They'll get access to
Some
those things.
mentors.
Yeah,
And we'll bond. And you'll bond with your team.
yeah, and you'll get to bond. So Sarah asked, "Where's that?" The retreat is where 3D Dentist has moved to, which is Raleigh, North Carolina. We're about 20 minutes north of the office now.
But they came to the course in Nashville.
Yeah, they came
She's
to
with
the.
Matt and Niece's
Oh,
team.
okay, they came to Nashville. Well, you need to tell Matt to come back down to Raleigh. In fact, I think he
He's
is
coming.
in
Yeah.
June. Right.
Yeah.
So anyway, Erin, you enjoy your stretching, and everybody here
Thanks.
on Facebook and our groups, please continue to submit your questions, and we'll see you guys. And let's get back to business in 2021.